Injuries come in all shapes, forms, and sizes, and we talked about some of the different types of injuries we can have to the different anatomical structures of the knee. Now, the symptoms that we will experience may vary from injury to injury and even from person to person within the same injury. But things that you want to be aware of is what type of pain do you have? Is it something that is sharp and very intense? Or is it something that's more of a mild or dull ache and is of a lower intensity? We also want to keep in mind, how did these symptoms start? Can we tie it back to a specific day or time or event that we did? Or is it something that has gradually progressed over time? These pieces of information help clarify, is it more of a bony injury, more of a muscular, tendon, ligamentous, or cartilage-related injury? The location of your pain is also going to be a very important factor. Is it on the front or the back of the knee? The inside or the outside, or the medial or lateral aspect of the knee? Or does it feel like it's deep within the joint? All of these descriptive terms will help your healthcare provider give you an accurate diagnosis and allow them to triage the situation with what the most appropriate plan of care and intervention strategies are for you. In addition to pain, we may also experience swelling. And this swelling can be on more of an inflammatory standpoint that is within the joint, that is tough to visualize, but can provide pain and provide discomfort. Or it may be more visible to the point where you can actually see it in and around the structures of the knee, and it looks larger when in comparison to the other leg. The presence of pain, the presence of swelling, this may also impact your range of motion or your mobility with your knee. With the knee, the two main functions that it does is extension and flexion, or straightening and bending the knee. Both of these motions are imperative to be able to walk and perform activities of daily living, such as walking up and down steps, up and down hills, squatting, kneeling, pivoting, and just being generally active with our day-to-day tasks, or even being able to tolerate prolonged positions of standing or sitting. If you are lacking ideal range of motion and mobility of the knee, a healthcare provider such as an orthopedic or a physical therapist can provide you with more information as what is limiting that motion. Is it something within the knee that is more internal, that requires imaging to diagnose if there is a tear? Is it pain? Is it swelling? Or is it simply a tight muscle? When we have an injury, we can also have an impairment or a deficiency in strength. And this may be because we actually injured the muscle and the muscle itself is recovering, or it could be because of the presence of some of the other things we've mentioned. Pain, swelling, and the inability to get into certain positions is going to influence how well our muscles can function. All of these activities will also play a role in the stability of the knee. And does it feel like the leg is stable, or is it giving way or buckling on us? If you're experiencing any of the following, these would be indications to seek out formal guidance from a healthcare professional. If you have pain that is significantly elevated, of high intensity, and you are unable to alleviate or influence that pain, that is a reason to seek out healthcare. If you have an inability to bear weight on your leg and you are unable to walk or put pressure onto the knee, that would be another reason to seek out guidance from a healthcare provider. When we look at how well our knee moves, if our knee feels like it gets stuck or it catches, or we're unable to fully extend or fully bend the knee, that would be another indication to get a set of eyes on it and figure out, is this something that's going to work itself out, or is it a little bit more serious? And then finally, if we are having any bouts of instability with the knee, meaning it is giving way on us as we're trying to weight bear, that's another situation where we need to make sure that the bones and the ligaments and the meniscus are intact and that we have the appropriate muscle structure and function to support it. When in doubt, it is never inappropriate to seek out guidance from your family physician, an orthopedic or physical therapy regarding the health of your knee, or if you've ever experienced an injury associated with a high level of trauma or impact, that would be another reason to seek out guidance. While we can never prevent an injury from happening, we can do some things to reduce the likelihood of it occurring and put ourselves in a more favorable position from a safety standpoint, but also from a performance standpoint. Things that will factor into our injury risk profile are things such as our flexibility, our strength, how we move and our coordination, and also the physical condition or the overall fitness levels that we are currently in. When we talk about flexibility or mobility, this is not only at the knee, but also at the ankle and the hip. Things that we like to look at with this is ankle dorsiflexion. And we can do a simple knee-to-wall test to look at how flexible and mobile somebody's ankles are, because when we get into activities such as squatting, running, and cutting, a mobile ankle helps take pressure off of the knee. Moving up the chain, back to the knee, which is the focal point for today, the two motions that we want to look at are knee extension and knee flexion, both of which the hamstrings and the quadriceps will play a large role. Lying on our back and doing an active straight leg raise is a great test to look at hamstring flexibility. And the goal for this is for the athlete to be able to get their leg vertical at roughly a 90-degree angle. From that position, we can then flip over onto our stomach and we can do a prone knee bend. This is also in orthopedic textbooks referred to as an Eli's test. And with this, we are seeing if the athlete is able to bend their knee and touch their heel to their back pocket or come as close as possible to that. When we look at mobility, it's important to see if we're able to hit these benchmarks, but also are there any differences from side to side. As we move up a little bit higher and we go into the hip, two common motions that we want to look at are hip internal rotation and hip external rotation. When we talk about pivoting, cutting, and twisting, common athletic movements in field and court sports, and with throwing and hitting, if the hips do not move well, that's going to put more pressure and more stress on the knee as it tries to pick up some of that slack with rotation, which it really isn't designed to do. Another test that we can look at the hip is how flexible our hip flexors, or the front of our hip, is. And this is something called a Thomas test. And a Thomas test can clue us into if we have hip flexor deficits and which muscles we should be targeting from a stretching standpoint. If we have tight hip flexors, that's also going to limit our ability to stride out when we run, which could lead to poor performance with regards to sprinting and running at top speed. Strength is one of the most protective things that you can do to help your knees stay healthy. And when we talk about strength, there's a variety of different ways that we can measure it. We can measure it in an isometric standpoint, which means we are contracting the muscle, but we are not moving. And one of my favorite ways to do this without any equipment needed is through a single leg wall sit. You have the individual sit against the wall, back flat on the wall, foot flat on the ground, at a 90-degree knee bend, and you hold that position for as long as you can, hoping to get 30 seconds. This is going to isolate the quadriceps, or that muscle on the thigh, which play a very large role in protecting the knee from injuries. Sticking to the theme of body weight strength, meaning we don't need any additional resources or weights beyond our own body for resistance, is another test that focuses on the quadriceps but adds a little bit more movement. So it's no longer an isometric. This is what we call an isotonic exercise, which means there's a lowering and a lifting, or an eccentric and a concentric component to the muscle contraction. One of my favorite tests to do, and it is a standardized test in the literature, is an anterior step-down test, where you have the athlete stand on one foot, they put the other foot out in front of them, they do a small single leg squat trying to tap their heel to the ground, and they see how many times they can do this in a given amount of time. You can compare that from side to side, and you can also find different normative data to see for your age and gender what is a normal number of repetitions to be able to accomplish. A Y balance test is another single leg body weight squatting activity that we can do. But the cool thing about the Y balance test is it adds in different directions. So there's a forward reaching direction and two backwards reaching directions that have some rotational components to it. With this, it is a very good way to see how does somebody squat and balance on one leg through different planes of motion that correlate with athletic activities. In addition to strength testing, you can also look at somebody's just general aerobic and anaerobic fitness levels. And my two favorite ways to do this are through a 12-minute run test and a 300-yard shuttle. For the 12-minute run test, you simply ask an individual to run as far as they can and cover as much distance as possible in 12 minutes. This will give you an idea of their aerobic conditioning levels. In a 300-yard shuttle test, you have a 25-yard track or field of space, and you have the individual run down and back, so a total of 50 yards, 6 times, and see how quickly they can do that. This will give you more an idea of their anaerobic function. Having a good fitness profile is a good idea and a way to see, are they in good shape to go out on a field and compete amongst their peers. In addition to monitoring flexibility, strength, fitness levels, some common sense things that we should make sure that we're doing is being aware of the types and the amount of activity that we're doing. So if we're a youth athlete, in a given season, how many different athletic teams are we participating on? In addition to participation in sports teams, are we also working out with strength and conditioning professionals, and are we working out on our own time? And having a good idea of if we are doing too much or too little for our desired physical activity and our abilities. In the moment of actually participating in sports, another thing that we need to do is make sure that we have a proper warm-up. And if we're going to be going out and doing specific activities, such as running cross-country or playing football, we need to make sure that we are not jumping into these activities cold, and that we have a warm-up that prepares our body adequately for the future activity at hand.